Controlling exposures to occupational hazards is a fundamental way to protect personnel. Multiple control strategies can be implemented at the same time. Along with elimination, substitution, engineering controls, and administrative controls, PPE is used to protect workers. Particulate respirators are simple and inexpensive, but are the least protective of the respirator types available to workers. They do not protect against gases, vapors, or chemicals, and should only be used when exposed or potentially exposed to low hazard levels. N95 respirators are a type of particulate respirator that's commonly used in general industry, construction, and in medical settings. They are classified as an air purifying respirator because they clean particles out of the air as you breathe. Some N95 respirators have an exhalation valve, and other types do not. Non-valved N95 respirators should be used to protect the wearer and others from SARS-CoV-2. The N95 filtering Facepiece respirator is designed to provide a secure facial fit. The N95 designation refers to the fact that the respirator provides 95% filtration efficiency of particles, and the N signifies that the respirator is not resistant to oil vapor. If properly fitted and sealed, the filtration capabilities of N95 respirators greatly exceed those of other masks described in this course. N95 respirators are tested and approved by the National Institute of Occupational Safety and Health, NIOSH. The use of respirators is regulated by the Occupational Safety and Health Administration, OSHA. While it is important to provide you with information on the N95 respirator, it is also important for you to know about other common masks that can be confused with it. Cloth face masks created from household items or made at home from everyday materials can be used as a voluntary public health measure. The CDC recommends community use of masks, specifically non-valved multi-layer cloth masks to prevent transmission. A significant portion of individuals with COVID-19 lack symptoms, and even those who eventually develop symptoms can transmit the virus to others before showing symptoms. This means that the virus can spread between people in close vicinity through speaking, coughing, or sneezing, even if those people are not currently showing symptoms. Masks protect wearers by helping to reduce inhalation of these droplets. Because of this, the Centers for Disease Control and Prevention, CDC, recommends wearing cloth face masks in public where social distancing measures are difficult to uphold, especially in areas of significant community-based transmission. Cloth face masks are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders, as recommended by current CDC guidance during the COVID-19 pandemic. Surgical masks are loose-fitting, with leakage occurring around the edge of the mask when the wearer inhales. Since a secure fit or seal is impossible, fit testing and seal checks are not required. Surgical masks are disposable and should be disposed of after every patient encounter. Surgical masks are fluid resistant. They provide the wearer with protection against large droplets, splashes, or sprays of bodily or other hazardous fluids. They also protect patients from the wearer's respiratory emissions. Surgical masks do not provide the wearer with an adequate level of protection from inhaling smaller airborne particles and are not considered respiratory protection. Dust masks are sometimes confused with N95 respirators, but dust masks do not provide the same level of protection. Dust masks are loose-fitting, have only one strap, and don't form a tight seal to the wearer's face. They are only to be worn for comfort against non-toxic nuisance dusts during activities like mowing and sweeping. These masks are not respirators and do not offer protection against hazardous dusts, gases, or vapors. They are not classified as a NIOSH-approved disposable filtering facepiece and will not have the NIOSH label printed on the mask or box. Companies that require employees to wear N95 respirators as PPE should have a written respiratory protection program with worksite-specific procedures. It's your company's responsibility to ensure workers are aware of and follow company respiratory protection requirements during work activities. OSHA also requires that respirator wearers be medically fit to wear a respirator, be fit tested, and receive respiratory protection training. While it's the employer's responsibility to develop and implement a program to protect employees who may be exposed to workplace respiratory hazards, it's the responsibility of each employee, including managers and supervisors, to follow the company's safe work practices and respiratory protection procedures. OSHA has provided temporary guidance due to the pandemic in regard to N95 or other filtering facepiece respirators, FFRs, fit testing. OSHA will be exercising enforcement discretion concerning annual fit testing requirements, as long as employers have made efforts to comply with the requirements of the Respiratory Protection Standard and follow additional requirements outlined in 2 news releases dated March 14, 2020 and April 8, 2020. In an OSHA news release dated April 3, 2020, the federal government advised that employers may consider using respirators and filters certified under the standards of other countries or jurisdictions, or certified under other countries or jurisdictions' standards, but are past their expiration date. To see the list, please visit OSHA's website. You should only wear the model and size respirator that was used and approved during your fit test. Wash your hands thoroughly before putting on or taking off your respirator. Begin by examining the respirator. The N95 has 2 straps and an approval number printed right on it. Inspect the respirator carefully and do not use it if it's damaged, discolored, or has been previously used. If you detect an issue, replace your initial choice with a new respirator. Do not allow anything to interfere with the fit of your respirator. Common factors that negatively affect a good seal between your face and the respirator are facial hair, jewelry, glasses, or clothing. Review and follow the instructions that come with your respirator. Depending on the task at hand, you may want to consider the use of a cleanable face shield over the N95 respirator when feasible to reduce surface contamination on your respirator. N95 respirators should not be shared or reused. With limited availability of N95 respirators due to the COVID-19 pandemic, the CDC has issued guidance, strategies for optimizing the supply of N95 respirators. The guidance recommends relying heavily on controls in addition to PPE to limit exposure. The controls include elimination, substitution, engineering, and administrative controls. To learn more, visit the CDC's website. If you experience signs of medical distress or if your respirator malfunctions, leave the area, remove the respirator when you are in a clean, safe location, and seek medical assistance. N95 respirators should be replaced when damaged, deformed, wet, soiled, or contaminated. Place the N95 respirator in both hands with the nose piece at your fingertips and the straps facing the floor. Place the respirator firmly on your face, covering both your nose and mouth. Hold the respirator under your chin with the nose piece up. The straps will hang below your hand. Pull the bottom strap up and over the top of your head. Place the strap behind your head below your ears. Grasp the upper strap and pull it up and over your head. Place it behind your head towards the crown of your head, above your ears. Do not allow the upper and lower straps to cross. If a metal nose clip is present, place your fingertips from both hands at the top of your nose. Slide your fingertips down both sides of the metal strip to mold it to the shape of your nose to create a secure, comfortable fit. Do not pinch the nose clip with one hand. Place both hands over the respirator and take a quick breath and hold. check to ensure the respirator seals tightly to your face. It should collapse slightly. Cup your hands over the respirator. Exhale. The respirator should expand slightly. If the respirator leaks during either check, reposition the respirator, adjust the nose clip, and then redo your seal checks. If you are still unable to get a proper seal, ask for assistance. Do not touch the front or the inside of the respirator. Make sure that you do not attempt to remove the respirator with contaminated hands or gloves. Remove gloves if gloves are being worn. Wash or sanitize hands if no gloves were worn prior to removing the respirator. Remove by pulling the bottom strap over the back of the head, followed by the top strap, without touching the respirator. Remove the respirator gently so any contamination is not dispersed. Place the respirator in a plastic bag or Ziploc bag. Secure the bag tightly. Place the plastic bag into the appropriate waste receptacle, such as a garbage can or biomedical waste disposal container. Wash your hands. Don't forget to follow your company's procedures for specific instructions on how to properly dispose of an N95 respirator. N95 respirators are commonly used to protect workers in general industry, construction, and in medical settings. In addition to what you've learned in this course, familiarize yourself with your company's respiratory protection program, the N95 respirators used at your site, and applicable site-specific procedures.